Okay, so we are group 1A, and we're going to get to talking about our systems of belonging in healthcare, and how that can relate to COVID and burnout. So for talking about systems of belonging, that's a big base for healthcare. And to get to that, we need to talk about what radical belonging means. And so when we were researching this, we thought it was beneficial to look up the definitions of those words by themselves. So according to the Oxford Dictionary, belonging is defined as an affinity for a place or a situation, and radical is defined as relating to or affecting the fundamental nature for something far-reaching or thorough, especially of change or action. And those definitions are pretty fitting for our situation. But to us, we decided that radical belonging means feeling welcome, wanted, and valued as a part of the healthcare team, and safe to freely express one's opinions, concerns, thoughts, and recommendations for the patient, the family members, and the healthcare staff. Overall, we have to encompass feeling valued and feeling like we can talk about things with our patients and our coworkers, without feeling like we're going to be talked down to, especially for the safety of the patient, for what's best for our family members and how we can best support our staff. And this quote I have here at the bottom is why I feel like it encompasses why this is important in healthcare. Not only do effective medical teams reduce errors and improve the coordination and efficacy or efficiency of care, they create a shared purpose and a shared mental model that fosters social connectedness and a sense of belonging. So it just fosters a really healthy environment for us as workers, for our patients, and for our family members, and it makes everyone's experience overall better.
Now we have read about Kadra. Kadra is a family medicine physician, and she faced a few problems within the COVID-19 pandemic. One of the few problems she had experienced was less time for individual patients, increase in stress and workload from the COVID-19 pandemic. The capacity for patients, it was at its maximum, and the staff continued to quit due to work conditions and high expectations. Doctors were forced to make decisions that went against their moral code to continue working. Some of the solutions that she could possibly try is to hire scribes, and also partner with other hospitals for equal distribution of patients. Also recruit new NPs, PAs, and doctors. Sarah is a registered nurse. She is a Midwestern American born in the United States who experienced difficulties during the COVID-19 pandemic. She is a caregiver of two children as well as a registered nurse. She faced many issues along with the pandemic, and she was unable to continue her nursing school due to her life situation. She was forced to balance her life with two children as a single mother. She constantly struggled with facing the disbelievers of COVID-19 in and out of her job. She lost her motivation to complete all of her work related responsibilities due to the cases of COVID she dealt with and seeing her patients struggle. Some suggestions that we should be giving Sarah is the opportunity to enroll into an affordable program like an online institution to continue her education. Also, possibly reaching out to family members to help her with taking care of her children. Another would be to educate parents and community members on the effects of COVID-19 on one's health and well being.
So another person we read about was Jessie. Jessie was a nursing aide who struggled with a little bit of depression after caring for her grandmother who suffered from a stroke. And while at work, many of Jessie's patients reminded her of her grandmother. Jessie also tends to develop deep personal relationships with her patients and loves to bring them treats. Her supervisor, however, tells her that this is unprofessional, reduces her efficiency, and makes her late to meetings. Jessie feels underpaid and micromanaged and hated by other coworkers since she is a lesbian Latina. This makes her feel isolated and exhausted. Jessie wants to study to be a social worker, but nobody in her family has attended college, so this feels like a stretch goal. One of the biggest solutions for this, for Jessie, is to offer tuition repayment for coworkers with years of experience. And then we also have Jonas, who works in environmental services. He only has a high school diploma, but he wants to move up in the organization. However, he still loves his current job. He fears that he might catch COVID-19 in the hospital and infect his family at home, but he keeps his current job for his good health insurance. He also feels as if he's not appreciated by other staff since it's quote unquote just environmental services. And he can easily become friends with patients. Some of the solutions to his problems is having an appreciation month or an appreciation week for people working in environmental services or even other specialties as well. And then also to ensure adequate PPE, hand hygiene, and vaccinations for coworkers in the hospital and the family and his household, just to prevent infection or infecting his family at home.
Okay, so now we have Andrea. She is the healthcare administrator, and some of her performance problems include that she feels tired post completion of tasks required of her as a new quality representative for her job. She also lacks engagement in leisure activities due to the demands of her new job. And there's also some patient concerns and family emotional outbreaks related to COVID-19, which have caused a lot of provider burnout for her. And last but not least, she has poor sleep schedule, which has impacted her overall mental and physical well-being. As for some solutions for Andrea, we had that we can provide some rest breaks during work-related tasks to promote balance between work and leisure activities. Another one is to set alarms on her phone so that proper sleeping strategies can be implemented into Andrea's nighttime routine. We also have that she could prioritize weekend hangouts with some of her friends and family members by creating a schedule so that she has that balance between work and leisure time. And then last but not least is to create different methods to enhance work performance throughout the day, such as listening to music, taking breaks, and moving around just to get her blood flowing.
All right, so here we've heard about some of the individualistic problems that are facing some of our healthcare employees. And at this point, we wanted to come together as a team to come up with some ideas that would essentially encompass all of these individual problems and try to fix them in a comprehensive way. So one of the things we wanted to do is make resources that are affordable, readily available to staff members. So for example, we've talked about maybe having more ways to get education, online programs where, say, a nurse wants to go to nurse practitioner school, or somebody that's working in custodial work wants to become a social worker, providing educational opportunities. We also thought that providing affordable childcare services at the hospital could help those who struggle to provide for their children while they're away at work. We also discussed better benefits and even proposed the idea of having a team of free therapists that could meet with some of these individuals who are feeling extra stress, and that therapy would be a good option for many individuals at the hospital. We also thought that offering bonuses to nurses to pick up extra shifts could be very beneficial. Creating more PRN jobs for nurses or other members of the workforce who have left because they couldn't keep their job. Providing PRN jobs would attract some of those workers back to the hospital to fill in gaps. We also want to hire scribes to assist with medical charting in general. And then we think that maintaining professionalism is vital. And one of the ways to do that is encourage people and all employees to avoid discussing polarizing topics and refrain from any, hate speech in the workplace. We also want to recognize the different department of the hospital each month. We think it'd be really fun to, say, highlight nurses one week and then highlight physical therapy or OT or other departments in the hospital, and have maybe a little luncheon and just kind of try to foster friendships between all of the different employees. We also would like to start a monthly or even a weekly email that highlights an individual. So for example, one week we might highlight Joe, the custodian, and give a little bit of a fun history on who Joe is and how he came to work at the hospital and what his interests and hobbies are outside of the workplace. Another big one we had considered was reinstituting daily team huddles. So giving a break in the day where everybody can come together, discuss needs with their teams, and just kind of coordinate and get back on the same page. And then we also discussed partnering with other hospitals to ensure more equal distribution of patients. So what this would look like is saying, if our patient load is seeing 400 patients per day throughout the entire hospital, whether that's clinics, primary care, ER, surgery, and making sure that other hospitals in the region are also seeing an adequate distribution of patients. So when it comes to discussing how our interventions can affect and benefit the marginalized communities, especially those who've been impacted by COVID-19, we now want to discuss how our proposed interventions will benefit those communities. So when it comes to affordable resources, we really think that a lot of people just struggled, especially during the pandemic, with the economy. And so anything we could do to make these resources more available and affordable, like the childcare services at the hospital or the online education programs, would be an excellent idea. We also thought that bonuses could really help those who might be struggling just to make ends meet. Those who are single mothers trying to watch over their kids and also hold a full-time job. And then in addition to bonuses, those that are working PRN or might need part-time jobs. Some individuals in our hospital system might have left during the COVID-19 pandemic just because they couldn't afford to work, take care of a family, and manage their lives. So providing part-time jobs or PRN jobs could accommodate individuals that are outside of the workplace. And then as far as scribes, this is something that, people often joke about, that everybody wishes they had a scribe, but in reality, it not only offers more job opportunities and gives maybe some of the marginalized communities who might someday want to go on to be involved in healthcare, it could give them an early opportunity to work in the hospital environment, get some clinical experience, but it really does take a load off of all of the staff as it speeds up the physicians or NPs or PAs and gives more time to individual patients to build and allows physicians to build a relationship with their patients. And then as far as maintaining professional speech, that should be something that everybody should strive to achieve. And we really don't want to see any of our employees feeling that they are being verbally abused or attacked. And so just a reminder to everyone and trying to keep peers accountable to one another in their speech. And then as far as the department recognitions and monthly lunches, we thought it would be a great welcoming environment, encourage everyone to socialize. And for individual staff recognition, we think that a lot of people get overlooked at the hospital. So trying to focus on those who might be isolated, we would try to recognize those individuals and show them that they are valued and that we care about them. The daily team huddles, again, like I mentioned, this is really to give everybody in the team an opportunity to speak up, to address any concerns that they've seen throughout the day. And then partnering with other hospitals is really the idea of, we want to make sure that there is enough access to care. So if we're overwhelmed at our hospital and we're not able to see everybody coming to our doors, that other hospitals, if they're not at full capacity, that they would be willing to accommodate those individuals.
So our proposals come with a lot of costs, some of them being the clinical education courses that come at no cost to staff. Also childcare services for the staff members, therapy services, hiring additional PRN staff. Those all will come into play when it comes to adding some costs onto the hospital. Also purchasing staff incentives, increasing individual provider pay, and additional PPE for providers and families to stay safe and prevent infections. Those will all cost a lot of money. Now, as in terms of funding, we have approached big corporations for philanthropic support, implement a hospital donor recognition program, apply for funding from AHRQ health services research projects, cater to inner city areas, and allocate funds to hospital projects with the intention to improve quality of care to patients.
And in terms of measuring success, we were thinking that we could send out individual surveys to patients after their stay. And we could see at the beginning of their stay what their responses were, and then after their stay, how their responses were before and after our interventions are in place. So specifically, we'd ask questions relating to the definition of radical belonging that we mentioned before. And then we were thinking we could assess the responses to our questions on a month-to-month basis and just check for improvement. And obviously, success will be measured by more positive responses after the interventions compared to those before the interventions. And then obviously, in terms of tracking success in terms of finances and making sure there's enough of that for all our interventions, we would have to track our finances before and after the interventions as well, to assess what else we need to do fundraising wise and to make sure we have enough financial support to continue our interventions. In terms of generalizability, we were thinking that the best way to do this would probably be to just gather the data that we create and then synthesize reports to share with other hospitals. And then since there are so many different types of hospitals and so many different types of healthcare systems in the US, we were thinking that the individual systems could scale their interventions as necessary. So an example we thought of was for a rural hospital with less resources, they could maybe get one free therapist instead of a whole team. And then in terms of longevity and sustainability, we would encourage hospital systems to identify their own sources of funding and ways to fundraise in their area before implementing these interventions as well. And I think that is all we had for our presentation. So thank you so much for listening and allowing us to present this.